this video, we're going to preview your activities for week 2 of the human skeletal system, where we cover the appendicular skeleton. As a review, the appendicular skeleton includes the bones of the pectoral girdle, the upper limbs, the pelvic girdle, and the lower limbs. Again, we saw the appendicular skeleton here highlighted by the yellow or the cream-colored bones. During lab, again, you're identifying bones and bone markings. As a review, your quiz and practical questions will read, identify this bone marking and the name of the bone. Continue to study and practice with the ability to distinguish right from left. You'll also be looking at joints of the appendicular skeleton. Just as you did with those of the axial skeleton, you should know the joint name, the articulation components, and the structural classification as written in the lab manual. Continue to practice spelling, and continue to bring your textbook and lab manual with you to help you find the structures you're responsible for knowing in lab. To begin with, girdles themselves, because they're part of the appendicular skeleton, need to be classified by the kind of bones that make them up. The pectoral girdle is formed by the scapulae and the clavicles, while the pelvic girdle is comprised of both the right and the left os coxa. These are considered parts of the appendicular skeleton because they're responsible for anchoring the upper limbs or the lower limbs to the axial skeleton. The joint tables in the lab manual here for the appendicular skeleton are very similar to what you saw in the first part. Again, the blue arrows are going to show you which sections you're responsible for in lab. So knowing the name of a joint, its articulation components, and its structural classification. Keep in mind that you need to continue to use both the major classification and the subclassification to identify structural classification of these joints. The functional classification and the description of movement will be tested in lecture but not in lab. Once again, you're working with human bones this week, so continue to treat them with respect. It's a reminder not to use pens and pencils to point to structures, rather to use the provided pipe cleaners. Also continue to return your bones to bone boxes when you're finished. You'll find that each table will have its own box with a complete set of the appendicular skeleton. Make sure that you're returning the bones to your bone box. At the end of lab, we go back through and try to make sure that they're all assorted correctly, so it helps us a lot if you can be doing that as the lab goes on. Again, you may be removed from the lab if you're not managing materials correctly. Once again, I remind you to review the terminology associated with bone markings. If you're covering this before you reach lab, then identifying many of these structures will be much easier for you. But once again, these terms will not be tested on the quiz or on the lab practical. To begin with here, we see bones of the pectoral girdle. As mentioned before, when they are articulated, they help to attach the upper limbs to the axial skeleton. The two bones that comprise this are the scapula and the clavicles. When trying to orient right versus left, there are some tips here. Keep in mind that the spine on the scapula always faces posterior, just like a dinosaur's spine sticks out of his back. In addition to that, the lateral angle is where the humerus is going to be placed. So you can see very clearly this is a right scapula, much like you would see in this image. In addition to that, identifying right versus left for your clavicle can be tricky. And so pay attention to the flattened end as the sternal end and the rounded end as the acromial end. You'll also find the conoid tubercle here on the inferior side of the clavicle, helping you to know how to write it up versus down. The upper limb bones that come off of that then are first the humerus, making up the major part of the upper arm. And then here in the antebrachium, you're going to see both the ulna and the radius. Keep in mind that in anatomical position, the radius here is going to line up with the thumb, and the ulna, with the head of the ulna here, lines up with the pinky. Right? So in anatomical position, this is what you would see anteriorly, and then this would be the posterior view. The olecranon that you feel here is going to be the sharp part of your elbow that you feel when you bend your elbow. In addition to that, the trochlear notch that you see is going to articulate with the olecranon fossa and the trochlea of the humerus to form the hinge joint of the elbow. When you look at the hand and the wrist, there's some tricky aspects to identification. To begin with, we look at the carpals, which make up the wrist. When naming these, name them with just the name that you see. For example, trapezium, trapezoid, right? And then capitate. You do not need to say capitate of the carpals. That's more or less redundant, so just name the bones. Also include your right versus left designation. This can be tricky, so spend time with the hands, making sure that you look at more than one to help you practice right versus left. As you move to the metacarpals, these are the bones which make up the palm of the hand. So if you flatten your hand, you can feel these bones by running your finger across the back of that flattened hand. So those are the metacarpals. You need to designate these by number as well as right and left designation. So this would be metacarpal 1 on the right side. So on a test, you could write right metacarpal number 1, or you could say right metacarpal of digit 1. Either answer is going to work for all 5 metacarpals. When naming the phalanges, it's important to designate them by number. So this would be phalanx of digit 1, digit 2, digit 3, digit 4, digit 5, and also designate them as right versus left. Finally, make sure you've included their position. The thumb has 2 phalanges, the proximal and the distal phalanx as seen here, while digits 2 through 5 are made up of 3 phalanges, so a proximal, a middle, and a distal phalanx. So if I have the pointer right here, then this is going to be the distal phalanx of digit number 2. When you move to the lower limbs, you begin with the pelvic girdle and the bones of the pelvis. This bone on its own, right, all 3 of these bones together make up what's known as the pelvic bone or as the os coxa. As you're identifying bone markings, make sure that you include the name of the bones that you see individually here. In yellow, you see the ilium. In green, you see the ischium. In pink, you see the pubis. The only times that you don't have to designate a bone marking with one of those 3 is when you are looking at the acetabulum right here or the obturator foramen. Those are going to be made by the junction of more than one bone, so it's all right to say the acetabulum of the os coxa or the pelvic bone. Make sure that you're looking at both a disarticulated os coxa, like what you see here, as well as an articulated pelvic girdle, much like you see here. In the lab manual, you'll see a series of terms that are used only to describe the articulated pelvic girdle, and you can see those identified right through here. To begin with, you can see what's known as the pelvic brim. So by definition, you can see it right over here. The pelvic brim in itself is the bony margin dividing what's known as the greater and the lesser pelvis. Everything above that brim is known as the greater pelvis, also called the false pelvis. Everything below that brim is known as the lesser or the true pelvis. You'll find also a term known as the pelvic inlet or the pelvic outlet. The pelvic inlet is all the space created by the pelvic brim, better seen in this version right here. So this would be the pelvic inlet, the space running from side to side, and the pelvic brim is the bony margin that forms it going all the way around. The pelvic outlet is going to run from the pubis back to the base of the coccyx. The bones of the lower limb, then, you want to continue to study these the way you did with the upper arm. Set them out and determine whether they are right versus left. So you would start here with the femur, right? Finding that the head would articulate with the acetabulum, there it is, the acetabulum of the os coxa. So that's one way to note that that's going to be the more proximal end. And here the patellar surface on the front of the femur articulating with the patella, and the condyles articulating then with the tibia. So this is the more distal end of the femur. Here's the proximal end of the tibia with a nice rounded condyle that matches right over here, the medial and the lateral condyles of the femur. So this is where you're going to articulate to form part of the knee as its hinge joint. Since this is the anterior view of the tibia, you see very nicely the medial malleolus, which would be the bump on the inside of your ankle. And beside that, you would see the lateral malleolus of the fibula. This is the bump on the outside of your ankle. This is a more tricky bone to orient in terms of right versus left, so make sure you're comparing the fibula with the articulated skeleton at the end of the room to see which direction it needs to be facing. As you move to the bones of the foot, just like with the hand, you want to first identify your tarsals, and much like the carpals, you're just naming them in terms of right versus left and their individual names. Right, so this would be the right talus, the right navicular. You do not need to say the talus of the tarsals. Just like you did with the hand, when you see metatarsals here, you're identifying them by number as well as right or left designation. So this would be right metatarsal digit 1. And just like with the hand, when you're identifying the phalanges, make sure that you're naming them by their number, their right and left designation, and their position. The big toe is going to be made up of the proximal phalanx of digit 1 as well as the distal phalanx of digit 2, while digits 2 through 5 have all 3, the proximal, the middle, and the distal phalanges. While you're studying the appendicular skeleton, you want to continue to use some of the good practices you developed with the axial skeleton. Be sure to use your textbook and anatomy.tv, both in preparation before lab and during lab. The more practice before lab, the better things will go during your lab time. So again, print off some of those unlabeled images from TCU Online, put them in page protectors, and practice writing the names of the bones over and over again. Again, read the descriptions in the lab manual when you're struggling to understand where bone markings or bones exist, and observe at least 3 types of each bone. You're going to be better able to answer questions about a femur on the practical if you've seen 3 different femurs in lab. The articulated skeletons will still be available in lab, and they are arguably more important during the appendicular skeletal lab than during the axial skeleton. They're going to be very helpful as you learn your joint anatomy. The location of the joints, the location of the girdles and how the bones articulate, and most importantly, for the orientation of long bones. So if you pick up a femur or a tibia or a humerus and you need to figure out the orientation of those bones, walk them over to the articulated skeletons in lab. This is going to help you to determine proximal versus distal ends, as well as to help you determine left versus right. Once you've done this, take it back to your table and using your textbook, actually learn the bone markings that are there. As a last component to studying, see if you and your lab group can work together to assemble parts of the skeleton at your lab bench. See how much you can build, and this is going to help you understand both the individual anatomy of the bones and the joints where the bones have articulated.